Her body was screaming that the baby was coming, but the hospital staff told her to wait. To fill out paperwork, this was a reality for Carrie Jones, a black mother in active labor at Dallas Regional Medical Center. A video viewed by tens of millions showed her doubled over in a wheelchair, crying out in pain, while her mother asked a nurse, "Y'all treat all your patients like this or just the black ones?" Just 12 minutes later, they finally moved her. Her son was born, revealing a terrifying truth about what happens when a black woman's pleas for help go unheard. The family's trust in a safe delivery shattered upon arrival. They were reportedly turned away from the emergency entrance and told to go to the main entrance. Once inside, Carrie's agonies were dismissed. For over 30 minutes, staff prioritized a clipboard over a woman in the final stages of labor. Her mother, Cash, recorded the scene, her voice trembling with rage as she pleaded, "Does she have to give birth in this chair?" The nurse allegedly refused to move Carrie until the papers were signed. This wasn't just a delay, it was a spectacle of neglect that forced her family to question if they were being ignored because of their race. The 12-minute delivery wasn't efficient. It was a crisis the hospital created. It proved Carrie had been in the final, most critical stages of labor while being told to wait. The calm, supportive environment she deserved was replaced by chaos. But the trauma didn't end there. Due to the intense stress, the baby had a bowel movement in the womb, a dangerous condition called meconium aspiration. This meant her newborn son had to endure a series of severe tests within the first 24 hours, leaving the family to grapple with the fear that the hospital's neglect had compromised his health. Carrie's story is not an isolated incident. It is a symptom of the black maternal health crisis in America. Black women in the United States are about 3 times more likely to die from a pregnancy-related cause than white women. According to the recent CDC data, while maternal mortality rates for white, Hispanic, and Asian women have declined, the rate for black women remains devastatingly high. These are not just statistics. They are stories of pain being dismissed and emergencies being ignored. Over 80% of these deaths are preventable, meaning they are the result of a healthcare system that is failing to provide timely and respectful care. The system chose paperwork over a person, and it nearly cost a child his health. Have you or someone you know felt ignored by a medical professional? Share your story in the comments. We have to talk about this to demand accountability. Share this video to raise awareness and subscribe for more stories that need to be heard. We must advocate for systematic change because no mother should ever have to fear her pain will be ignored.
Is your due date? When's your due date?
Right now.
Is your due date?
What?
How many times have you been pregnant?
3.
This is your 3rd pregnancy? You
Yes.
have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Okay, this is the personality patient for you. His last name is Jones. She's G3P2. I'm not sure what her due date is.
Her due
I
date is
just
the
said it
10th.
was the 10th.
I think her due date is the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people here.